Welcome to EMS Office Hours. This is Jim Hoffman, and these are your Monday Minutes. Guys, today we're going to finish up this section of soft tissue injuries, bleeding, hemorrhaging, okay, before we start moving on into the shock element of the Monday Minutes, right? Now, of course, before we get into that, guys, I always like to talk about why this stuff is important and mention to you that it's not just for your exams. All right. Now, granted, this is key information. You're going to see this stuff on exams throughout your EMS career, but it's also built, and this is designed to help you move your knowledge base, to move that knowledge needle just a little bit so you keep improving, you keep refreshing your memory on the key concepts of EMS, and that's going to help you make better clinical decisions. It's going to help you write better reports. It's going to help you interact with your partners, family members, patients, doctors, nurses, whatever the case may be. So it kind of all encompasses stuff, guys. And I try to break this down into smaller chunks so it's easier for you to digest it, easier for you to understand it. And I hope if anything doesn't ring true to you or you're not understanding it right, to go ahead, you're going to crack open your textbook. You're going to use something online, a blog, a website that you favor, or even something like my membership site over at paramedic.com. Whatever the case may be, guys, move that knowledge needle just a little bit, and I think you're going to find that while this key information is going to help you pass exams, it's also going to help you much more throughout your EMS career if you really take it for what it's worth. All right, so let's get into it, guys. This is just kind of a graph here that I pulled from the EMS Quick Study Guide and talks about the stages of hemorrhage, okay? And I think it's important to know the different stages, guys, and we talk about the different levels of blood loss, okay? The one thing I will mention, when you look at this 15%, 25%, right, and the stages of the actual blood loss that somebody might have, okay? And this could be, the type of blood loss you see in a traumatic event, right? But think about it. Visible blood loss, what you see, isn't always that great a way to judge the severity of an injury. Okay, so just keep that in mind, guys, when you're thinking about, when you're kind of trying to gauge what the person's, what stage of hemorrhage they might be in. Okay, so just kind of, you can look at this here, guys. You can actually pause this if you want. Take a look at this, kind of get a better grasp of it. And I think if you look at this graph, I think it'll help you when you're looking at not just the stage of hemorrhage, but also things to think about when you start talking about getting into shock, right? And what are different signs and symptoms you're gonna see. For instance, with pulse pressure or blood pressure, okay, where in stage 3 you're gonna get that decreased systolic blood pressure, narrowed pulse pressure, right? But you're gonna have maybe an increased diastolic in stage 2 for blood pressure, where you're going to still have that narrowed pulse pressure. Okay, just some things to think about, guys, when you're trying to gauge blood loss in a patient and what stage of hemorrhage they might be in. Now, again, like I said, visible blood loss, not always a great indicator, okay? But you got to also think about, because the body's response to the bleeding, right? That you get that local vasoconstriction wherever the blood loss might be at. Platelets are being formed, coagulation is happening, okay? This is the way the body is trying to go ahead and stop the bleeding on its own without you applying bandages, without you doing other interventions to stop the bleeding. So the body is trying to work to get that bleeding, stopped. So it depends upon what type of injury it is or why they are bleeding. Maybe it's some type of an internal bleeding going on, and why and what the body response is going to be, and also how you go ahead and manage it. Okay, now we talk about management, guys. Lots of things we can do for patients, and this is really, we talk about just a basic level of things, right? Before we get to giving intravenous or, giving people ringers, lactate, things like that. We have our basic stuff, right? Your BSI, right? That's not here, but of course you have to remember your BSI precautions, right? But also the direct pressure, the elevation when it's in extremity, right? Leg and arm, you want to elevate that extremity, right? Applying additional dressings, using things like a pressure dressing and a pressure bandage, right? That's other things you can do to help stop the bleeding as well. Okay, pressure points. Okay, it depends upon your protocol and what your training is and what's accepted in your region. But certain pressure points are appropriate for certain arterial areas. Okay, especially things like extremities. Right, you're not going to do a jugular vein, right? But you might do a brachial artery. You might do a femoral artery and try to do a pressure point there when the patient is bleeding from an extremity. When it's a very heavy bleeding, you can't seem to control it. Nowadays, of course, too, we're back into using tourniquets. And a lot of times when we get to the point where it's not being stopped with additional dressings, we don't waste time anymore, right? We're getting right into the tourniquet use, okay? Other things you can do, which are pretty common, but a lot of people don't do it. I don't see a lot of people do this thing, is just elevating the legs, trying to keep the patient warm, okay? All ways to try to keep the blood loss less and managing the blood loss, but also preventing and trying to treat for shock, right? Now, oxygen is here, and depending upon where you are, where you fit in, what your protocols are, oxygen may or may not be something that's available to you, right? But most of the thinking is the patient's oxygen saturation is 94%. You're not really going to give them oxygen, but it can be an option. And of course, you want to follow your local guidelines and whatever you feel, whatever your textbook is telling you to do at the time of this video, whether or not you're going to give oxygen for patients that are in a traumatic event or have some type of hemorrhage going on. And of course, you want to initiate transport as appropriate for the patient, depending upon how heavy the bleeding is, what their vital signs are. Thinking back at that graph that I showed before, talking about the stages of hemorrhage, right? What stage of hemorrhage are they in? If they're bleeding a lot, your transport's going to be much, much sooner, right? And of course, guys, you always want to go ahead and reevaluate your patient, reassess vital signs, reassess the bleeding. Has it stopped? Okay. Distal pulses, things like that. Okay. Sometimes even splinting can be an option. Again, depending upon your guidelines, what your textbook is telling you at the time of this video. Sometimes splinting an extremity is also a method of trying to also help stop the bleeding and also start treating for the shock as well. Okay, guys, we're going to talk a little bit here about internal bleeding because it is part of hemorrhage, right? It's not necessarily traumatic unless there's a traumatic cause to it, but there are bleeding and hemorrhage that goes on as well. Some of this is covered in the abdominal section and GI part of the Monday Minutes as well, but we're talking about hemorrhage here, and I want to talk about the internal bleeding aspect of it. And usually you're talking about, chest, abdomen, pelvis, right? Or retroperitoneum, okay? Those are areas you're going to see that internal bleeding. And again, most of the time when you talk about trauma for this, seat belts that happen, falls, things like that can cause an internal bleed that you might not actually see, which is why I mentioned before. Sometimes the visual aspect of it might not be anything that might alarm you. That's why you have to assess your patient, take the blood pressure, take the pulses, and be aware of what other things that could be going on. So I put some signs and symptoms here that are pretty common when we talk about internal bleeding. What you might see: coughing up blood, vomiting blood, especially coffee ground type vomiting, right? Or even bright red emesis, right? Those are the type of things you're going to see when patients vomiting blood. Keep an eye out for that bright red blood or the coffee ground type blood. But again, coffee ground would be more along the lines of an internal bleed that's been going on for a little bit, right? Didn't just start happening the 5 minutes before you got there. Okay, patients might be dizzy, might be nauseous, they might have orthostatic systolic blood pressure changes. They might have pain, tenderness to an abdomen. Their abdomen might be rigid. Patients can be cool, pale, diaphoretic. Again, thinking about that hemorrhage scale we talked about as well, right? Pulses, depending upon where they are on that hemorrhage, scale and the stage of hemorrhage. The pulse might be normal or could be rapid or weak. Okay, keep an eye out for patients that complain of maybe some pain, but also they have some bright red or dark tarry stool. Okay, other things to think about as well, guys. Also, blood in the urine. All right, and of course, general hypotension as well. This is kind of broad, right? Trying to hit all kind of the major signs and symptoms you'll see with internal bleeding, but All things to think about, guys, when you're doing your inpatient impression, when you're assessing your patient, and you're thinking about what might be going on with them, what might be causing these symptoms, right? The patient's telling you they're coughing up coffee ground type vomit, or they tell you they have dark tarry stool and they have a low blood pressure or orthostatic change, or maybe they're a little cool. Okay, start thinking maybe they have some sort of internal hemorrhage going on. Okay, things to think about, guys, and this is why these Monday Minutes are all built to kind of help you piece it together, right? No one 5 to 10 minute Monday Minutes that I do here is going to give you all the answers. They're all meant to piece it together. And also, again, if some of this I'm talking about doesn't make sense, or maybe it's not ringing true to you because maybe you forgot some pieces here, well, you might think that's a problem. It really isn't. It's really going to help you because now you can go to your textbook, crack it open, and refresh your memory on some of this stuff. All right, guys? All right, guys, I'm going to end it there. Next week, we're going to get into shock, okay? And hopefully we'll be able to round it all off next week as far as the hemorrhage and injuries go and soft tissue trauma, stuff like that, and get into shock. So I'm going to try to go ahead and make next week, it's going to be a little bit of a longer episode because I want to wrap up, get all the highlights and all the key points in shock in one video. Okay, guys, be sure to join me. Love for you to engage with me, guys. I'm at EMS Safe on Twitter and also on Instagram. And if you check me out on Facebook, you can go to facebook.com/the EMS Professional and join me there as well. Guys, if you find this stuff interesting, if you like moving your knowledge needle, if you like building your knowledge base and being prepared and trying to be the best EMS professional you can, I encourage you, go check out Paramedic. There's a free level membership which is called Paramedic Insider, and you get access to gigabytes of digital content, hours of audio and videos, practice exams, and even exclusive access to me as well as part of the Paramedic Insider membership. It's totally free. You can sign up at emsseo.com/insider. Okay, I hope when you become a free insider member that you'll be motivated and want to get access to all the other content that's in the members area and join me as a premium member once you do that. I'd love to see you on the inside and love to see you in the private Facebook group as well. So go check that out, guys. Again, it's emsseo.com/insider. All right, guys, that's it for me. Again, if you have questions, comments, concerns, or ideas for on Monday Minutes, send them over to me. My email is contact@emsofficehours.com. And you can, of course, watch all the other Monday Minutes on YouTube at the EMS Safe YouTube channel, or you can go ahead and go to emsofficehours.com and see all the previous episodes there as well, in addition to the podcast. All right, guys, that's it. As always, I am Jim Hoffman for EMS Office Hours and the Monday Minutes. Stay safe.